Good day, everyone. Our topic for today is all about skin infection. Our skin is a large organ that covers and protects our body. Our body skin has many functions. It works to hold in fluid and prevent dehydration, keep you feel sensation such as temperature or pain, keep bacteria, viruses, and other causes of infection, stabilize your body temperature, and also synthesize or create vitamin D in response to sun exposure. There are many different skin infections, but today I will be discussing about three common skin infections with their cause, symptoms, treatment, and prevention. And these three are: first is the methicillin-resistant Staphylococcus aureus, or also named as MRSA. Second, the Molluscum Contagiosum. And third is the Impetigo. The MRSA, or methicillin-resistant and Methyllococcus aureus, is an infection caused by Staphylococcus bacteria. This type of bacteria is resistant to many different antibiotics. These bacteria naturally live in the nose, on the skin, and generally don't any harm. However, when they begin to multiply uncontrollably, a MRSA infection can occur. MRSA infection typically occur when there are cut or break in your skin. MRSA is very contagious and can be spread through direct contact with person who has the infection. It can also be contracted by coming into contact with an object or surface that been touched by a person with MRSA. Though a MRSA infection can be serious, it may be treated effectively with certain antibiotics. The MRSA have two different types. First is the HAMRSA and second is the CAMRSA. The HAMRSA is associated with infections that are contracted in medical facilities, such as hospital or nursing homes. You can get this type of MRSA infection through direct contact with an infected womb or contaminated hands. You can also get the infection through contact with contaminated linens or purely sanitized surgical instruments. HAMRSA can cause severe problems such as blood infection and pneumonia. The CAMRSA is associated with infection transmitted through close personal contact with a person who has the infection or through direct contact with an infected womb. This type of MRSA infection may also develop because of poor hygiene, such as infrequent or improper hand washing. The symptoms of HAMRSA is generally more likely to cause serious complications such as pneumonia, urinary tract infection, and the blood infection sepsis. It's important to see your doctor right away if you notice any of the following symptoms. First is the rash, headaches, muscle ache, chills, fever, fatigue, cough, shortness of breath, and chest pain. While the cause of CAMRSA usually causes skin infection, areas that have increased body hair such as the armpit or back of the neck are more likely to be infected. Areas that have been cut, scratched, or rubbed are also vulnerable to infection because your biggest barrier to germs, your skin, has been damaged. The infection usually causes a swollen, painful bump to form on the skin. The bump may resemble a spider bite or pimple. It often has yellow or white center and a central head. Sometimes, an infected area is surrounded by an area of redness and warmth known as cellulitis. Pus and other fluids may drain from the affected area. Some people also experience a fever. The second type is the Molluscum Contagiosa. It's a skin infection caused by the virus Molluscum Contagiosum. It produces begin rest bump or lesions on the upper layer of your skin. The small bumps are usually painless. They disappear on their own and rarely leave scars when they live untreated. The length of time the virus lasts varies for each person, but the bump can remain from 2 months to 4 years. Molluscum contagiosum is spread by direct contact with someone who has it or by touching an object contaminated with the viruses, such as towel or piece of clothing. Medication and surgical treatment are available, but treatment is necessary in most cases. The virus can be more difficult to treat if you have a weakened immune system. The symptoms of Molluscum contagiosum: if you or your child come into contact with M. contagiosum virus, you may not see symptoms of infection for up to 6 months. The average incubation period is between 2 and 7 weeks. You may notice the appearance of a small group of painless lesions. This bump can appear alone or in a path of as many as 20. They're usually very small, shiny, and smooth in appearance. Flesh-colored, white or pink, firm and shaped like a dome with a dent or dimple in the middle. Filled with a central core of waxy materials, between 2 to 5 mm in diameter or between the size of the head of a pin and the size of eraser on the top of a pencil. Present anywhere except on the palm of your hand or the soles of your feet, specifically on the face, abdomen, torso, arms, and legs of children, or the inner tight genitals and abdomen of adults. However, if you have a weakened immune system, you may have symptoms that are more significant. Lesions may be as large as 15 millimeters in diameter, which is about the size of DIN. The bumps appear more often on face and are typically resistant to treatment. While the causes of Molluscum contagiosum are: you can get Molluscum contagiosum by touching the lesion on the skin of a person who has this infection. Children can transmit the virus during normal play with other children. Teens and adults are more likely to contract it through sexual contact. You can also become infected during contact sport that involve touching bare skin, such as wrestling or football. The virus can survive on surfaces that have been touched by the skin of a person with Molluscum contagiosum. So it's possible to contact the virus by handling towel, clothing, toys, or other items that have been contaminated. Sharing sport equipment that someone bare skin has touched can also cause the transfer of this virus. The virus can remain on the equipment to be transmitted to another person. These include items such as baseball gloves, wrestling mats, and football helmets. If you had Molluscum contagiosum, you might spread the infection throughout your body. You can transfer the virus from one part of your body to another by touching, scratching, or shaving a bump and then touching another part of your body. And the last infection is the impetigo. Impetigo is a common and contagious skin infection bacteria like Staphylococcus aureus or Streptococcus purulens infect the outer layer of skin called the epidermis. The face, arms, and legs are most often affected. Anyone can get impetigo, but it most commonly affects children, especially those aged of 2 to 5. The infection often begins in minor cuts, insect bites, or rash such as eczema, any place where the skin is broken. But it can also occur on healthy skin. It's called primary impetigo when it infects healthy skin, and secondary impetigo when it occurs in broken skin. It isn't always easy or necessary to make this distinction. Impetigo is an old disease. The name dates back to 14th century England and comes from the Latin word impetare, meaning to attack. Seems a fitting description for this easily spread infection. Bacteria thrive in hot, moist conditions, so impetigo tend to be seasonal, peaking in the summer and fall in northern climates. In warm and humid climates, it tends to occur year-round. The symptoms of impetigo. The first sign of impetigo are reddish sores on the skin, often clustered around the nose and lips. The sores quickly grow into blister O's and brows and form a yellowish crust. The cluster of blister may expand to cover more of the skin. Sometimes the red spot just develop a yellowish crust without any blister being seen. The sores can be itchy and occasionally painful after the crust phase. They form red marks that fade without leaving scars. And sometimes have a less common type of impetigo, which larger blister around the diaper area or in skin fold. These fluid-filled blisters on brows, leaving a scarly rim called a collarite. Impetigo can be uncomfortable. Occasionally, it may involve swallowing glands in the area of outbreak or a fever. While the cause of impetigo is an infection caused by a strain of strach or strep bacteria. These bacteria can get into your body through a break in the skin from a cut, scratch, insect bite, or rash. Then they can invade and colonize. The condition can be contagious. You can catch this bacteria if you touch the source of a person with impetigo or you touch items like towel, clothes, or sheet that the person used. However, these bacteria are also common in our environment, and most people who came in contact with them won't necessarily develop impetigo. Some people normally carry staph bacteria on the inside of their nose. They may get infected if the bacteria is spread to their skin. Adults and children are the higher risk for impetigo if they first live in a warm, humid climate, have diabetes, are undergoing dialysis, have compromised immune systems such as from HIV, have skin conditions such as eczema, dermatitis, or psoriasis, have a sunburn or other burns, have itchy infections such as lice, scabies, herpes simplex, or chicken pox, have insects bite or poison ivy, and play contact sports. While the treatment of impetigo or the antibiotics effective against impetigo, which of type antibiotics you get depends on how widespread or severe the blister are. First, if you have impetigo in only a small area of your skin, topical antibiotics are the preferred treatment. Options include mupirocin cream or ointment. If your impetigo is severe or widespread, your doctor can prescribe oral antibiotics such as amoxicillin, certain cephalosporins, or clindamycin. These drugs may work more quickly than topical antibiotics, but they aren't necessarily better at clearing the infection. Oral antibiotics can also cause more side effects than topical antibiotics such as nausea. With treatment, impetigo usually heal in 7 to 10 days. If you have an underlying infection or skin diseases, the infection may take longer to heal. There are 3 types of impetigo based on the bacteria that cause them and the source they form, each type through a series of stages. First types is the non-bullous. Non-bullous impetigo is mainly caused by Staphylococcus aureus. It's the most common form of impetigo, causing an estimated 70% of cases. It goes through the following stages. First, it usually starts with reddish, itchy sores around the mouth and nose. Second, the sores break open, leaving red and irritated skin around them. Third, a brownish-yellow crash form. And lastly, when the crash hair, there are reddish spots that fade and don't leave scar. The second part is the bullous. Bullous impetigo is almost always caused by Staphylococcus aureus bacteria. It's usually form larger blisters or bullae filled with a clear fluid that may become darker and cloudy. The blisters start on unbroken skin and aren't surrounded by reddish areas. The blister becomes limp and clear and then bursts open. A yellowish crusty source forms over the area where the blister broken open, and the blister usually leave no scar behind when they heal. And lastly, the echema. This more serious infection is much less uncommon. It occasionally happens when impetigo isn't treated. Echema goes deeper into the skin than the other form of impetigo and is more severe. The infection forms painful blisters on the skin of the buttocks, thighs, legs, ankles, and feet. The blister turn into pus-filled sores with a thicker crust, and often the skin around the sores turn red. The eczema sores heal slowly and will leave a scar after they heal. So that's it for today. I am Myla T. Sarmiento, and this is my discussing about the 3 common skin infections.